Americans are driving themselves to the emergency room during heart attacks and strokes, not because help isn't available, but because they can't afford the ride. 1 in 10 people who needed emergency care avoided calling 911 because of cost. That decision carries a 22% higher chance of dying within 30 days. And the ambulance billing system behind this trap was deliberately left unprotected by federal law. 10% of American adults say they have hesitated or refused to call 911 during a medical emergency because of ambulance costs. The number climbs to 12% for rural residents and reaches 18% among the uninsured. These findings come from a 2022 Kaiser Family Foundation survey that used a nationally representative sample and direct questions about real-life decisions. The results are not limited to a single region or age group. Older adults, people living outside cities, and those without insurance all report even higher rates of avoidance. Behind each statistic are stories of people weighing their health against their bank account. In one documented case from Cook County, Illinois, a patient with stroke symptoms waited 3 hours before seeking help after a family conversation about a $2,800 ambulance bill. Hospital records confirm the delay. In another case, a woman suffering a heart attack chose a friend's car over an ambulance after a previous $4,500 bill. These are not isolated incidents. Emergency physicians, EMS chiefs, and coroners across the country describe a pattern of patients arriving late, sometimes too late, because they feared the cost of a ride. The data shows how widespread this problem has become. The National 911 Annual report for 2021 counted around 240 million calls nationwide, but a review of monthly numbers found a clear dip in medical emergency calls during periods of intense news coverage about ambulance bills. In districts where local media highlighted ambulance charges of $5,000, EMS chiefs reported a 7% drop in 911 calls. The consequences are deadly. A peer-reviewed study found that patients who drive themselves during a heart attack or stroke are 22% more likely to die within 30 days, compared with those who arrive by ambulance. The delays mean missed treatments and worse outcomes, especially for time-sensitive conditions. In stroke cases, patients arriving by private vehicle waited an average of 36 minutes longer for life-saving therapy. These numbers are not just statistics. They represent a national pattern of avoidable harm. The fear of an ambulance bill, documented by surveys, hospital records, and clinical studies, is changing how Americans respond to emergencies. The result is a silent toll measured in lives lost and health compromised, driven by a system that puts financial risk at the center of a medical crisis. A single ambulance invoice can read like a financial puzzle, but the numbers are anything but random. Most ground ambulance bills start with a base fee, often between $800 and $1,500, just for dispatch and pickup. That is before a single mile is counted. The mileage charge stacks on next, typically running $15 to $40 for every mile traveled. For a suburban ride of 12 miles, the math alone can add $180 to $480 to the total. If the call requires advanced life support, such as heart monitoring or medication administration, another $300 to $800 appears as a separate line item. Specialized equipment, oxygen, or extra personnel can each add hundreds more. Audits of ambulance company charge masters show these rates are not set by accident. In California, a 2023 audit found base charges ranging from $1,200 to $2,000, with mileage rates as high as $50 per mile in some rural counties. In Texas, invoices reviewed by the Attorney General's office routinely listed totals between $1,400 and $2,700 for standard transports. These are not rare outliers. Nationally, most ground ambulance bills fall between $1,200 and $3,000, according to the Government Accountability Office and multiple state insurance departments. The structure of these bills reflects more than medical necessity. Private ambulance providers, especially those owned by national chains or private equity investors, set rates that far exceed what Medicare or Medicaid pays for the same service. A 2023 ProPublica investigation uncovered internal documents from major ambulance firms showing that list prices are routinely set at 2 to 3 times the government reimbursement rate, with the expectation that insurance will pay only a portion and the rest will be billed directly to the patient. Each itemized charge, from mileage to critical care surcharges, is designed to maximize revenue under a patchwork of local and state regulations. For-profit operators, now controlling a majority of ambulance transports in many states, use these detailed invoices to capture every possible dollar. The final result is a system where the final bill can reach $3,000 for a routine ride and much higher for longer distances or more intensive care. For many patients, the shock comes weeks after the emergency, when the invoice arrives with a total that rivals a month's rent or a mortgage payment. The details on the bill, base rate, mileage, advanced support, equipment, are not just numbers. They are the financial architecture that drives fear, and for some, the decision to avoid calling 911 at all. An ambulance bill rarely stops at the total on the front page. For insured patients, the real calculation begins when the explanation of benefits, EOB, arrives in the mail. This document breaks down what the insurer will pay and what the patient still owes. In the case of an out-of-network ambulance, the numbers can be stark. The insurer may cover only a portion, leaving the rest as a balance bill directly to the patient. This is not a rare occurrence. Data from the Government Accountability Office shows that the median balance bill for ground ambulance transport is $450. But for 1.2% of patients, the balance due jumps above $3,000, sometimes reaching $5,000 or more. The EOB lays out the process in black and white: total charges, insurer payment, and the remainder, often labeled patient responsibility. A single ambulance ride can turn into a months-long debt burden, even for those with insurance. The Government Accountability Office dataset reveals the scale of the problem. In states without consumer protections, thousands of patients each year receive bills that far exceed what their insurer paid. The median may be $450, but the outliers are life-altering, and they are not as rare as the industry claims. These balance bills do not stem from medical complexity or rare circumstances. They are the result of a system where out-of-network ambulance providers routinely charge list prices and pursue the unpaid portion from patients. The EOB becomes not just a summary of care, but a notice of personal liability, a warning that the financial consequences of a 911 call can last long after the emergency is over. Federal law draws a bright line through the heart of the ambulance billing crisis. The No Surprises Act, signed into law in December 2020 and made effective in January 2022, was celebrated as a shield against unexpected medical bills. But deep in the statutory text, Section 2718C lies a deliberate carve-out. Ground ambulance rides are not protected. The law bans balance billing for emergency room visits, for out-of-network doctors at in-network hospitals, and for air ambulances. Ground ambulance transport is missing from the list. The omission is not accidental. Federal rulemaking in July 2021 reaffirmed that ground ambulance bills are exempt from the Act's core protections. Patients who need an ambulance on the ground remain exposed, their bills governed by the old rules of network status and provider discretion. This legal gap is not a secret. The Centers for Medicare and Medicaid Services, the Department of Labor, and the Department of the Treasury have all issued guidance confirming that ground ambulance services fall outside the federal ban on balance billing. Consumers are left to navigate a patchwork of state laws, if any exist at all. Congress did not ignore the problem. The No Surprises Act directed the creation of a federal advisory committee to study ground ambulance billing and recommend solutions. In April 2024, the Advisory Committee on Ground Ambulance and Patient Billing delivered its final report. The committee called for ground ambulance transports to be brought under the same federal protections as air ambulances, including a ban on balance billing and the creation of a fair payment process for disputes. Yet as of mid-2025, those recommendations remain just that, recommendations. No new legislation is passed. The statutory carve-out is still in place. Until Congress acts, the federal government's own law leaves millions of Americans vulnerable every time they call 911 for an ambulance. Right now, a single ambulance ride can trigger bills from $1,200 to over $100,000, often with no federal protection. The system's loopholes aren't accidents, they're policy choices. Until lawmakers close them, emergency care in America remains a gamble. The stakes are real and they're rising. Stay informed.